Welcome to the Health Leaders Exchange podcast. I'm Abby Mathis. We're at the Clinical and Financial Teams Exchange here in Nashville, Tennessee today. I'll let our guests introduce themselves and then we'll get started.
Yeah. Hi, good morning. This is Charlotte Ipsan. I am the Chief Hospital Officer for Norton Healthcare in Louisville, Kentucky.
Awesome. Longtime friend and member of the Exchange. So I want to talk to you about different models of care, and it's a conversation that's been coming up more frequently in our exchanges that kind of ruffles a little bit of feathers for some, but I think it's an important conversation to have, especially given the healthcare landscape that we're in right now. So you're a former nurse, so I'm sure you've kind of seen waves of how models of care can change. Do you think that we're hurting ourselves by maybe holding to one model of care and trying to fit it to each health system, I guess is the best way to put it?
Yeah, and certainly through the years we have seen primary nursing, team nursing, a lot of use of licensed vocational nurses, those types of things. And I don't think there's really one model of care that works now, right? You have to be flexible and to be able to alter those models of care for different levels of care.
Right.
You know, we talk about the critical care setting, and then the, we see a lot of that in the healthcare system that I'm in, neonatal intensive care units, adult intensive care units, cardiovascular units, and the needs vary for that. We also look at letting folks work to the top of their license. We've seen that a lot in the MD APP model. And in various levels, acute care versus, non-acute care, various uses of that. So I think we have to really take a deep dive and to let ourselves be vulnerable to trying different things in different parts of the healthcare system. So many opportunities. We also talk about in some of those levels, bringing in our what we call SHAWs, Student Health Associates, into that and bringing them in much earlier than we have before. So there's so many things that those folks can do to take that burden off of maybe that nurse or that respiratory therapist, all of that, to really function much better as a care team. So yes, we have hurt ourselves to try to box us into something. And it doesn't even, the same model of care doesn't even work in one building.
And I feel like maybe the idea doesn't exist. I mean, given where we are post-pandemic, that's not realistic anymore. The traditional model that we think of maybe pre-pandemic, that everyone's hurting for nurses and ancillary positions, like we can't try to fit that into one box.
There are not those number of graduates that are coming out. They're just not there. It's simply a math problem. And we have to change, it's a different type of algebra that we need to use right now, for sure.
Absolutely. So are you reintroducing LPNs? It's a conversation that we've been having with our nurse leaders, and I think we most recently had it at our CEO exchange. You are reintroducing them back into your health system?
Absolutely.
And how's that going?
It's, there was resistance, as you could imagine. In the beginning, there's a huge push in many, organizations around, master's prepared nurses, doctoral prepared nurses, and that. So it's not to take away what we need that for. But I worked back in the day, neonatal intensive care unit, and I worked with LPN. That was unusual back then. I'll just say it was more than 30 years ago. And if you are, that skill set is amazing, what they have. And so there were certain things you have to obviously pay attention to, what the state licensed those folks to do. But tremendous help in even taking a full assignment. This licensed practical nurse could take a full assignment. They just couldn't administer blood or push meds. There are plenty of patients that they could take care of and just be that, extension to true collaborative working relationships. So I'm excited to reintroduce LPNs in many parts of our organization as well, to again help relieve the burden of those RNs that we traditionally have, made assignments out with. This goes, well beyond RNs too, as
Right.
we look at respiratory therapists. Physical therapists have figured it out, PTAs that are working with them. And again, just collaboration is the key for this, but it is our answer.
Right.
For the
and
future.
So have you started, or are you starting, or where are you at in the process?
Yes, we have many of our units that already have them. And then, we also have to look at that workforce.
Right.
How do we embellish that workforce? So I'm proud to share something that we've done and have partnered with a school in our community. And we're working with high school students. And it is a program where that high school student comes out and has one more year, and then they are able to function as an LPN.
That's key.
And then, if they choose to, we will continue to assist them in their education journey to get an RN if that's what they want. But, again, I think previously there was a lot of clinical work that happened as part of your education. And we've seen that shift, and certainly COVID threw us for a loop, with that.
Right.
So then, students coming out, new grads coming out, did not have those true clinical experiences and how to address one-on-one. They did a lot of work in sim labs, and we know that that's a great embellishment, but that shouldn't be primary.
Yeah.
So yes, we use LPNs in many of our areas already, but we need to continue to create workforce and really explain. We've got a virtual program going on where we're in high schools and in junior highs, because I don't know if you've been with any of your friends lately that say, my goodness, by grade school, when you're getting ready to go into high school, you already have to pick your classes that takes you on a track. If you don't know anything about it, so we've got, we're using the virtual reality to walk these junior high and high school kids through a day in the life. A day in the life of a respiratory therapist, a day in the life of an engineer, a mechanic, a lab tech, respiratory therapist, all those things. And that has brought a lot of energy. And then we go ahead and extend that program and let these high school students come in. And if they can work 2 hours, they get out of class and they want to come in for 2 hours, we'll give them tasks to do within the facilities in their areas of interest. So it's been life-changing, and we're just getting started.
Yeah, and I mean, you're building the pipeline, which is a huge, another big topic that we could go on and on about.
Right.
That is a huge need is, like you said, the math isn't there. There's, there's not the people in the schools available. So building the pipeline is crucial as we look to the future.
Absolutely.
So do you think that virtual care models, which is unplanned, but a lot of what we're going to be talking about at this exchange, do virtual care models fit into this different models of care, and have you looked into that at all?
Absolutely. We have a team right now working on implementation for virtual care. It's much like AI, right? It's here.
Right.
So it's here and available with some of the virtual nursing models we have. There is some controversy, obviously, of not having a live person.
Right.
But I personally have used chat bots and many of those things, virtual care. So I do think it is, again, to help embellish the care that we do.
Right.
I think huge, just as, again, a nurse by trade working, in critical care most of my career, I can see that double verification. So things that actually help us provide safe care, and sometimes are it delays care, right?
Right.
If you're going to give a narcotic and you need it to be double checked, or you're double checking blood, does it have to pull another caregiver out of another room to make that happen? Or can you access the virtual care nurses that are sitting like an air traffic control and able to say, come in on that armband and say, yes, I am here with you to verify that this is the appropriate, patient to give that to. I think there's lots of opportunities around that. And just those simple questions, even having parents or folks that have been in the hospital, they don't
Right.
want to hit that button and create someone to
Right.
come in the room for them. They
Right.
feel like it's a burden.
Right.
And we try to say, absolutely, it's not a burden, but they know, they can hear the hustle and bustle of
Right.
what those caregivers are trying to
And,
do.
if they feel like it's a silly question that maybe's been explained, but they're still not understanding, maybe they're reserved. And then, what does that then
Right.
create for the patient if they don't have the understanding?
Right. And I think it's, the better educated and the more our patients and families understand and are part of that care.
Right.
So I think that these virtual options just continue to reinforce and make them feel more comfortable that really they're hitting a button and someone's on the TV. Then if they need, additional information, that caregiver can come in. So that's where I see, and I've, talk to other organizations that are starting to use that, and I think it's a soft entry. I don't think we come in wham bam.
Yes.
Bring it in soft. We're piloting a couple of areas.
Okay.
And technology is key with that. So a lot of IT integration and really using all the tools that we have and just using it as one more tool
Right.
to help increase touch points for our patients and their families. So that's where I see it really being a big help to those caregivers. I talk about a lot. Let's reduce the chaotic episodes that we
Right.
have in healthcare.
Right.
No one wants to go home feeling like they didn't meet the
They were
needs
putting out
of their
fires
patient.
right.
Right. So anything we can do to reduce that burden and to bring extra support in. We're also looking at something that is using a robot to help deliver items.
Okay.
It's not unusual at all to be, I walk the halls a lot in our hospitals, and to be walking down the hall and you see this poor provider stretched out with their head stretched out. They're in their isolation garb and they know they can't go past the red line or they're going to don and doff their equipment, saying, can anybody bring me, some warm saline?
Yes.
And this actually, this robot then is programmed, and you can say, please bring saline to room 462. And it comes in, has a belly that opens up, and the nurse, caregiver can get that out. So we're actually looking at that as well. Again, all the tools, right?
Yes,
Nothing will ever replace, that one-on-one touch point with providers and our patients. But anything we can do to help them,
Help the patient.
certainly is.
I like the term kind of soft ease into it. So we'll start by just having the question of, what is this medication? You can see that virtually. Then, okay, I have an applicable question about the medication. Then we bring in the nurse. So just so that the nurse isn't coming in back and forth a million times into the room, they have someone that they feel like they're not, maybe bothering as much as a way to kick off this kind of virtual nursing program. I like that a lot.
Yeah. And almost like the Alexa approach,
Yeah,
right?
yeah.
The patient can say, hey, Sally, hey, Jim,
Yeah.
I've got a question.
Yeah.
And the TV can pop up with a live face,
Right. And a
on
real
there
person.
too,
Right.
that is answering those questions. So just sign us up for all of it,
Yes,
because we need all the help we can get.
Yes,
To
absolutely.
help our caregivers.
So the last question, and it's still in the same vein, does your staff, I can't imagine that they would, but I know technology can be a little touchy for some people. Do they have any pushback on this virtual care? I'm sure it's a lot around, the logistics of it.
Yeah,
and the dealing with it. Or are they
Yeah.
asking you for more?
They're different camps,
Yes,
right?
yes.
I think it depends on where you entered healthcare. Sometimes,
Sure.
for those, there is a little bit of fear that it would replace, which we know it would never replace.
Right.
There's a teeny bit of that, I think.
Yeah.
With everything, what are they looking to do? But most are so energetic and excited to be part of it and to figure out how we can tweak and adjust again for different areas. So we've heard nothing but excitement. We, listen a lot.
Right.
We say to those folks, we're here. I have a magic wand question when I'm rounding. I'll say, if you had a magic wand, what's one thing we can do to help support you your caregivers or your patients.
Right.
And some of this is really just that support.
Right.
And saying how do we better use technology. Some of it's a little scary, but we've already gotten past that, right? With electronic medical records
right.
and some of our voice activated things that we use. So I think for the most part, we're past the oh no technology because we're in the throes of it every day with what it is. And they all just want to provide the very best care and support, their colleagues. So all of this makes sense.
Good. Good. It's nice to have, I'm sure for you too, when you're looking at the different technologies that you can implement a yes, please approach. From your staff, because we hear from others that their staff aren't excited about the things that they're bringing in, and it's out of fear and the unknown and all of that's very understandable, but to have a staff that's like, let's just try it.
And I think it really is just getting their feedback.
Right.
We will have the robot I'm talking about. We had folks raise their hand to say, hey, can I be part of that?
Right.
And we say, you go figure it out. You go lead. You tell me then where we should best implement it.
Right.
And so it's a staff-led initiative then, and really taking that feedback seriously. So we've worked with some great partners that are doing that, but I think really understanding the barriers and being willing to pivot based on what they're saying is so important.
Right, just like we talked at the beginning, there's no one model, there's no one best technology that works in the one best way.
One silver bullet.
Yes, yeah. But if there was. Well, thank you for joining us today. More conversations like this to be had at our exchange, and we'll see you next time.
Thanks.
Thank you.